Welcome to our overview of a randomized control trial or RCT application. We will be reviewing a 2020 study by Shafee, Mirghavorand, and Havizari on the effect of prenatal counseling on breastfeeding self-efficacy and frequency of breastfeeding problems in mothers with previous unsuccessful breastfeeding, a randomized control trial. Here are 10 great reasons to breastfeed your baby from the Government of Canada. Breastfeeding experiences. Mothers with previous breastfeeding experience of exclusive breastfeeding for less than 3 months are more likely to stop breastfeeding earlier than mothers who previously exclusively breastfed for more than 2 months. Methods. There were 108 pregnant women with previous unsuccessful breastfeeding randomly assigned into intervention or control groups. The intervention group had 4 prenatal breastfeeding counseling sessions, and the control group received routine care. A statistical analysis was performed to determine they needed a sample size of 54 participants in each intervention and control group. Randomization was done using www.random.org by someone not involved in the sampling or data collection processes. Inclusion criteria were the ability to read and write, residing in Debris with previous unsuccessful breastfeeding experience, singleton pregnancy, ability to consistently attend counseling sessions, and in the 3rd trimester of pregnancy. Exclusion criteria were fetal abnormalities, high-risk pregnancies, and breastfeeding contraindications. Data collection was done using the breastfeeding self-efficacy scale. Participants in both the intervention and control group completed the questionnaire in the 15th day, 2nd month, and 4-month postpartum. This is a Likert scale using 33 breastfeeding self-efficacy items. Participants rated the items with a score of 1 to 5, 1 being totally disagree to 5 being totally agree. The scores can be 33 to 165, with higher scores indicating higher self-efficacy. A test-retest analysis was used to determine the reliability of the breastfeeding self-efficacy scale. There were 1,532 pregnant women screened for the study. 212 pregnant women were found to be eligible. 108 pregnant women agreed to participate. 7 women were excluded due to not attending follow-ups, and 101 women participated throughout the entire study. Self-efficacy scores. As you can see, they found that the intervention group had higher self-efficacy scores at each 15 days, 2 months, and 4 months postpartum. And the self-efficacy scores increased much more in the intervention group than they did in the control group, and they did find these results to be statistically significant. RCT issues. There are some internal validity issues with RCT, such as selection bias. This was prevented in this study by using random allocation and allocation concealment by having the allocations written on a piece of paper and placed in consecutively sealed opaque envelopes, then handing out the envelope in the order of participant entry. Attrition bias is when participants in one group do not attend follow-up as required. This was controlled for by using the intention to treat approach, where all participants are included in the final analysis, regardless of if they completed the study. Random error was controlled for by having a sufficient sample size. As for external validity, internal validity is needed to have external validity. In this example, the target population would be mothers with previous unsuccessful breastfeeding experience. The study sample may not be an accurate representation of the target population, as for example in this study, screening was done over the phone. Any patients without a phone would therefore have not had the chance to enroll in the study. Patient preference can affect external validity, as only patients without a treatment preference can be included in RCTs. With low percentage of the population willing to partake in RCT, external validity can be hindered. RCT benefits. Randomized controlled trials are often seen as the gold standard in the context of evidence for healthcare. Using randomization helps to balance confounding factors between groups. And blinding. Single blind studies are when the participant does not know which treatment group they are in. Double-blind studies are when neither the patient nor the provider know the treatment assignment. This ensures unbiased outcomes due to knowledge of treatment assignment, which is typically not possible in other study groups. Thank you for joining us for this presentation. Here are our references.